A report was just released last month by the New Hampshire Attorney General about a deadly shooting at the New Hampshire hospital last year. It confirmed something that our News 9 Investigates team had revealed earlier, that the shooter had previously been committed to a mental facility but was still allowed to be able to purchase a firearm because he lied on his purchase form, and there was no information in the system to catch that lie. Now, New Hampshire is one of only a handful of states that does not send this information to the mental health information about commitments to the federal background check system. Senator Morse, should this change? Why or why not?
No, I believe in law-abiding citizens, and this problem that we have in New Hampshire with mental health is what we need to address as a society. I've worked hard to make sure that we give options. I've made it even easier for groups to come into communities, and the stigma of mental health, you know, we have to eliminate that in society. I think that's the important way of doing things in our state, is to take action and get it done. I've worked on mental health issues.
Senator Ayotte, you were obviously Attorney General for a time there. This information was not entered during that time. In retrospect, should it have been?
Adam, so under federal law, already that information should have been in the system. But the problem is federal law does not have a due process mechanism to allow someone who seeks mental health treatment to actually get off of that system. So in other words, we want to encourage people to seek mental health treatment. We don't want a system where someone's constitutional rights are taken away from them, yet there's no due process mechanism for them to actually petition a court when they're better, when they've received treatment. And so that's the important thing. I think it's important, yes, those records should be in, but we need a due process system in place. The federal law doesn't provide that, and that's, in fairness, has to be provided so that we can support those who are seeking treatment and never discourage treatment for mental health.